Well, good afternoon, folks. Judge-Executive Al Mattingly here. We're going to do our weekly COVID update. And then today I have a very special guest with me, Sarah Adkins from the Owensboro Regional Recovery, is going to talk about how the COVID pandemic has impacted ORR, what they've done trying to maintain everybody in a safe and healthy manner, how their funds went to pot, really, Sarah, and then what they've done to get the funding. But first of all, Jordan, let's put up that first slide. Today, there were 15 COVID cases in Daviess County reported. That gave us, by the way, Sarah, you can, since you're in your office by yourself and I'm in my office, we can remove the mask. I do that every time I come on, just to remind people that how important this is, one of those lines of defense. And Judy and I have had both of our shots, but still we wear a mask when we're out in public, when we're not among just the two of us, because you still possibly remember the Moderna and the Pfizer are 95% effective. Well, there's that 5%. The Johnson & Johnson's about 75% effective. There's that 25%. So if I've got a chance to have this protection along with other layers of protection, I'm going to use it. As you can see on the screen, we've had in Daviess County 9,624 confirmed cases, 8,726 have recovered. That's a 90% recovery rate, which is really great. Unfortunately, we've had 160 deaths in Daviess County attributed to COVID. So if you would just pause with me for a second and let's remember those folks who have passed on. Let's remember their families and all their friends, as they suffer in grief regarding these deaths. Thank you. As I said, 15 new cases a day. Currently, we have 2 hospitalizations. So that's 2 folks in the hospital. And that's a really long descent down from when we were at 32 to 35 about 6 to 8 weeks ago. And the number of people that you have in the hospital is an indicator of how severe their infection is. Continues to drop our active cases. That's the number of folks that we have. It's the difference between confirmed cases, recovered cases, and deaths. So we have 738 folks in Daviess County who are recovering. They're active. Talking with Clay Horton at the Green River District Health Department, we probably could multiply that before, and that would be a better indicator. So almost 3,000 cases walking among us. And a lot of those don't know that they have COVID. Practice the 3 W's, wear a mask, wash your hands, and watch your social distancing. Avoid large crowds. And the CDC just came out with a new guidance for those who have had both their COVID shots. And when you're in a group of folks where everybody has had COVID, then you can take your mask off. You can have those small gatherings. Personally, I'd wear the mask if that person wasn't within my own household, but that's just me. Jordan, show me the state map. If you look now, you'll see Daviess County is still in the orange at 12.2 cases per 100,000. That's good compared to what it was last week. Look at the bottom of the map and it says overall current incidence rates, 14.34. What that means is that Daviess County at 12.2 is in a better position than the entire Commonwealth of Kentucky at 14.34. We keep a tally of the cases reported by Daviess County, the Daviess County Health Department. And if our numbers are accurate, we are right on the verge of going into the yellow. We calculate today with the 15 cases reported today, replacing about 22 from the same time last week, that we are right at 10.5 cases. One more single digit day and we will see Daviess County on this map in the yellow. Last slide, Jordan. All right, this is something that Daviess County, along with the Green River District Health Department and some other partners, have developed. This is a flyer that we hope to get distributed. It's about the COVID-19 vaccine, and it's an outreach that everyone is trying to push. So if you look, it says everyone who qualifies for a vaccine and wants the vaccine should get the vaccine. If you don't have a car, if you don't have a computer, there's still no problem. We'll work with individuals and organizations to ensure access to the COVID-19 vaccine in Daviess County. And you'll see two columns. One is the individual column, and there's a phone number to call. The other is an organization column and a contact. And what we're looking at is organizations can get together and come up with a list of 50 names and phone numbers that we can get to the health department. They will work with you trying to provide a mobile vaccine site for those 50. Let's flip it over on the other side. Where are vaccines available? I mean, there are a multitude. I think in the governor's update today, there are over 550 sites that are available in the Commonwealth today. Owensboro Health, Daviess County Health Department, Nation's Medicines, Walmart, both Walmart, Sam's Club, Kroger's Pharmacy in 2 locations on Frederica and Starlight, Walgreens on Frederica and West Parish, as well as Kentucky 54, Myers out in Heartland's Crossing, Danhire Drugs, Pools Pharmacy, Wilson's Family Pharmacy. You can go to vaccine.kentucky.gov and the vaccinefinder.org, and it will list those most recent providers. Who provides transportation? Well, if you can't get there, if you don't have some family member that can drive you, if you have a disability and you need help, GRITS, the transportation, Audubon area GRITS, which is public transportation, if you will give them a 24-hour notice, you can call them and arrange to take you and one other person with you if you need help to get the vaccine. Now you have to have a documented appointment. You can't just say, I want to ride over to, let's say, Owensboro Health because I heard that if I stand in line a while, they'll give me a vaccine. No, you need an appointment, but if you have that appointment, we can provide you transportation to and from. And the phone number is at the bottom as well. All of this you can find on the Daviess County Fiscal Court webpage, a wealth of information, or you can go to kentuckycovid19.ky.gov for a whole host of other information regarding COVID and the vaccine. Thank you, Jordan. Well, as I said, our special guest today is Sarah Adkins, and Sarah is the director of what we all commonly call ORR, and that stands for the Owensboro Regional Recovery Center. Sarah, welcome today.
Sorry, I was muted. Thank you for having me. I'm glad to be here.
It's okay. Folks, let me assure you, very seldom does Sarah muted. She pretty much says what she wants and when she wants. Sarah, tell us about ORR. There are a lot of people that don't even know what it is, what it does. Tell us a little bit about it, the number of regional recovery centers there are, and perhaps I know that we have a men's recovery center here. Maybe tell us where a women's recovery center would be. So I'm going to give it to you for a while. I may interrupt you and say, oh, I've got some other questions.
That's fine. So we are Owensboro Regional Recovery. We are located here in Daviess County at 4301 Beach Road. We are a long-term substance abuse recovery program for men. We are part of the Recovery Kentucky Network. Back in 2005, Recovery Kentucky was started under the Fletcher administration as a cooperation between Kentucky Housing Corporation, the Kentucky Department of Corrections, the Department of Local Government, and Governor Fletcher convened a group to say, look, we have homelessness in Kentucky, and one of the primary causes of homelessness is substance abuse and addiction. So we want to address both of these issues. We want to address the housing issue as well as the substance abuse issue. And so those folks that formed a committee and came up with an innovative approach to addressing homelessness and addiction. And they started in the first recovery center opened in 2005. That was the Warm Center, Women's Addiction Recovery Manor in Henderson that serves women. And then there was a similar program that opened in Moorhead, the Moorhead Inspiration Center, around the same time that the Moorhead program serves men. We are based on a program in Louisville called the Healing Place. We use their model. It is a 12-step based curriculum, peer-to-peer support. There's also a similar program in Lexington that uses that model called the Hope Center. But after 2005, the Recovery Kentucky initiative pretty much just took off, and the regions started opening their own facilities, placed kind of strategically across the state. So we were actually the 9th center to open. We opened in February of 2010. And right now, today, there are 14 centers across the state. So there are 8 for men and 6 for women. So
what capacity, what's the capacity of the center?
Okay, so pre-COVID, our capacity was we could hold up to 108 people at a time. Of course, because of COVID and because of the need to practice social distancing and to have spaces to allow for quarantine and for times to testing time and things like that, we have had to reduce our capacity. So right now, if we could take everybody that we could take in, we could probably hold about 60 people safely with adhering to all of the recommended practices with social distancing, because of a lot of factors, one of them being that people haven't been reaching out for help as much. Also, court systems have not been as active during COVID. So we've had a lot of reasons why our referrals have not been as robust as they have in the past. So right now, today, our census is 48.
Okay.
So,
Sarah, that's interesting. Court referrals brings to mind, well, if I want to go to ORR, if I recognize that I have a problem and I'm not in the court system, I'm just on the street wandering around, how do I get in? Do I have to be referred by somebody, or can I come knock on the door and you'll take me, you'll do an analysis? Tell me how that works.
So no, you do not have to be referred by the court or by probation and parole, although that's how we do get most of our folks that come to us. We do take self-referrals or people who are off the street that want to come. The start of how to get in is to call us anytime, 24 hours a day. Our phone is answered 24/7. The number is 270-689-0905. And we do a screener.
Say it again.
270-689-0905.
Okay.
And we will do a screener over the phone. They'll actually talk to a live person. And the screener takes about, 10 to 15 minutes, I'd say. And it just asks them some basic questions about, why they feel like they need help, where can they be located, do they need any immediate attention, like if they have any kind of medical or mental health crisis going on, do they have any court obligations that they'll have to attend to within the next few weeks, or so we're just getting basic information from them. And then if or when we have a bed that comes open, we would contact them and give them a day and a time to report for intake. Are the
folks that and Jordan, I'm kind of getting a feedback here. I don't know what's going on, but are they locked in? In other words, are they free to come and go when they want, how they want? Can they work a job while they're with you? And if so, I would imagine that they're going to pay some of their board and keep, and knowing that if you went from 100 people to 48 people, probably your revenues went straight down the tube.
That's right.
Because I know my brother, and I've told the story, and the community knows my brother was addicted to meth, and thank goodness went through the court system and was sent to Wayside Mission in Louisville. which I'm not sure if they practice the same, but they're long-term.
Yes.
I mean, he was there a year and came back home, and the court said, well, a year was great. We're going to send you up there another year. And he ended up deciding to stay and help be a counselor. And I think that you will agree with me that those who have struggled through addiction have recovered and straightened their lives out, sometimes make the best counselors, the best
Yes.
folks for those who are struggling today. So
Yes,
tell us
that
a little
is
bit about that.
That is the model that we use also. Peer support is, we're very heavy on peer support here. So, remind me again what you said at the beginning. I'm sorry.
If I come in and say, Sarah, I want to come
That's
into
right.
the organization, can I walk out the door the next day?
Okay, that's right. Yeah. So we are considered long-term. So long-term is they'll be here at least 6 months or more. So in general, for the first 6 months of the program, they're pretty restricted to being here. And especially during COVID, since March of last year, most of our clients have not left our building unless it's for essential medical care. Mm-hmm. So we don't, right now, because of COVID, we're not going out in public. We're not going to any AA or NA meetings in the community. Now, hopefully, once we get past this COVID pandemic and things go back to more life as we used to know it anyway, the way things will be is that depending on where they are in the program, how long they've been here, they will get certain privileges where they would get to leave property. They might get to go visit with family. They might get to go to outside meetings. They might get to go visit with the sponsor. So no, we're not locked in that, if somebody comes in our program and they decide for whatever reason that it's not for them, they don't want to be here, they have other things they need to attend to, they can actually leave the program at any time. They don't really even have to tell us. They can just walk out the door and, they're whatever entity that they have to deal with that sent them here or wanted them to come here, it's between them and that, authority, not us. So no, we're not locked down.
Okay. Well, everybody, when they think about a recovery center, thinks about high barbed wire walls, razor bits, and all that. That's not us. But let me assure you, particularly in the spring and summer and fall, when I ride my bike along the green belt, I pass ORR and wave at the guys, and they're in the back. They're barbecuing or they're grass. They're just they're shooting baskets. They're doing whatever. From the outside, you wouldn't know it was a recovery center. Now, the most important thing: where are you located?
We're at 4301 Beach Road. So we are adjacent to the Greenbelt, and you drive past us. Most people in Owensboro drive past us a lot because we're right next to the bypass. So
Sarah, and let me just say this real quick. There was a lot of angst from folks when ORR was first proposed for Owensboro and Daviess County. Concerned about, you're going to have the addicts, you're going to have the homeless, you're going to have these folks. To my knowledge, there's been absolutely no trouble from any of the folks who have been in that program.
I agree. And some of the angst was it kind of settled before I came along. So I wasn't really involved with that in the early beginning, but we appreciate our neighbors, and, we generally have had very little issues with anyone. So I'm very grateful for that, and we're very lucky that we have been supported by our community. So.
Before COVID, you guys ran a pretty good catering service, didn't you? You cooked. We
did, yes.
Yeah, and is that for the general public? I know several of the organizations and boards that I was a member of on occasion would be fed by ORR staff and individuals. But I assume you would cater anybody that requested it.
Yes, now we have kind of had to limit that, of course, because of COVID. So our clients are not going out in public. But the catering was a way for us to financially support the program by also giving our our clients an opportunity to learn some skills working in the commercial kitchen and being able to interact with people in our community and help them make connections through that catering venture. So unfortunately, because of COVID, that's another way that we have been sidelined and that we have taken a financial hit, because in order to keep everyone safe, we have not been able to do any public events like that.
But I don't have to say this because I know it's true. Post-COVID, if you want a caterer, you need to contact ORR. And let me assure you,
Yes.
having eaten many meals that were provided by those men, it's excellent food. They do
a good job. Yeah, they do.
Good job. And with a smile on their face, very professional, really. So there's 108. Your capacity is about 108.
Right.
Is that 108 Daviess Countyans?
No, actually. So we are a regional recovery center. So most of our clients do come from the western part of Kentucky. We get a lot of referrals, of course, from Daviess County and from the surrounding counties, Henderson, Ohio. We do get a lot of referrals also from just outside of our 7-county region. So Muhlenberg County, Hopkins County, like that. About 60% of our referrals come from our 7-county region.
Okay.
Then another probably 20% would come from other parts of the state. And then we do get about 20% of our referrals from the metro areas of Kentucky, like Louisville or Lexington. And then we do have a very, very small number, and we can take people from out of state. The bordering Indiana counties, not since COVID, but prior to COVID, we would occasionally get referrals from Spencer, Perry, and Vanderburgh counties specifically. But that's very small. That's a very small number.
Okay. So again, let's talk about your finances because I want folks to understand. I know every year we do a CDBG grant to ORR. We don't do the grant. It comes through the Department of Local Government, I assume, and that's roughly $200,000. At one time, it was a lot more. It was more than that. Yeah, it's been reduced, and so that money is used simply for operations, the best I remember call. I do know that there was a special request for $200,000. I think this was through the CARES Act money or from the CARES Act money. And we had just talked prior to going on the air. We got notice that we received that money, that grant. But how do you, so you cater some, how is your other revenues? Do you take donations?
We do. We take monetary donations as well as in-kind donations. So if someone, maybe they don't have money to give or they don't feel comfortable giving money, we also take food donations. We take clothing donations. We'll pretty much take any kind of donation. If we can't use it, we'll pass it on to somebody who can. So our finances, of course, we're like every other nonprofit. I don't know of any nonprofits that haven't been extremely affected due to COVID. When our referrals went down approximately half, that means we lost half of our revenue. And we also had additional expenses because we had to make changes in our building so that we could adequately social distance. We've had professional cleaning. We've had purchase additional cleaning supplies. We had to provide adequate personal protective equipment for all of our employees and clients. And these things are ongoing. So it wasn't like it was a one-time purchase and then you're done. I mean, this is constant in order to keep everything we can to keep our clients and our staff safe. So, I mean, we had probably an additional $50,000 in additional expenses just related to COVID in 2020. And that, of course, that has carried over into 2021 now. So budgetary issues are definitely a concern. And the CARES Act money that we had through CDBG will help us make up some of that difference. But it's not going to put us ahead. Like, we're certainly not going to come out in the black, even with that money. That's really just kind of helping us stay afloat from the losses that we had last year. Also, our biggest fundraisers have been things that we did in person, like a golf scramble and our alumni day picnic in September. All of those things we had to cancel because it wasn't safe due to COVID to bring large groups of people together. So we've had to come up with some innovative ways to try to fundraise and to cover that gap that we have. So am I okay to plug a fundraiser we've got coming up right now?
Not yet.
Oh, not yet. Okay.
Still questions.
Okay. All right. I'll hold off then.
All right. And don't let me forget it though.
Okay.
The individual that's there, this isn't a free ride for them, is it? I mean, if they're working,
that's right.
They will contribute.
They have to contribute. Once they get, if they have income, in other words, if they receive any kind of like a disability check, or if they have veterans benefits, or if they have, some sort of income coming in, they have to pay rent based on the amount of their income. Now, because they are here pretty much for the first 6 months without working, a lot of these guys don't have any income right off the bat. So they don't have to pay rent if they don't have income. But once they do start working, when they get to what we call phase 2, which is the transition phase of our program, if they start working, they will have to pay rent based on the amount of their income.
Okay. So one of the things tell me how we know, and this is where you get to your reunion. Tell me how we know this works. Tell me how we know this model works. Tell me, because I can tell you, I'm there, but in your own eyes, you see the people come in, you see them go. Do you ever see them after that?
Yes, yeah, we do. I mean, we know anecdotally just from interacting with our clients that we have people who are out there contributing to their families, their homeowners, their business owners, their employees. They have started their own companies. They have, purchased, like I said, purchased homes. I mean, they're doing well, and we interact with them on a regular basis. One of the best ways that we know it works is we bring them back every September. Unfortunately, we couldn't in 2020, but hopefully 2021 will be different. We bring them back for our annual Alumni Day, and they are allowed to come back and bring their families, and we get to see them and hear how they're doing, and they get to see each other. It's kind of like a big reunion. And so we know that they're doing well. Another way we know they're doing well is that we are studied by the University of Kentucky. Our clients participate in an outcome study where when they first come in the program, they complete a survey, and the survey is pretty extensive. It asks them a lot of questions about their drug use, about their homelessness, about their involvement with the criminal justice system. It's pretty thorough. And then after they leave the program, whether they complete or not, they may complete the program, they may not, but then after they leave, UK follows up with them and will ask them those same questions as a follow-up survey after they've been out of the program about 6 months to a year. So every year we get a report from UK that shows how we're doing. Are our guys, reporting that they have jobs? Are they reporting that they're sober? Are they reporting that they're involved with the 12-step or a support group? Are they reporting the improvement in their mental health issues, housing, and things like that? And we are very happy to say that every year that report looks very good. That we have about between 75 and 80% of the folks that they interview a year after leaving are still sober, and that's just amazing. That's just amazing numbers. So
that everybody talks about recidivism, and
right.
to have such a high rate of success, that is unusual. If now I don't think I have missed one of the reunions. It's one of the highlights of my year, because again, I've been there. I know what it is to have a loved one who struggles with that sickness, that illness. But besides that, that I'll buy tickets on the baskets that you got. You'll make some money off of me.
Yeah.
If an individual, someone in the community wanted to come and participate, buy some raffle tickets and talk with the folks, are you open to the general public during one of those things?
Yes, on those events are open to the public. And we've actually had people just kind of wander in off the street because they drove by on the bypass and saw like the bounce house out there,
right.
Something like that. So they just kind of showed up to say, hey, what's going on? So yeah, we're definitely open to the public that day and want, people in Owensboro to come enjoy that day and bring their kids and, just have fun, on our program and learn about what we do.
Well, Sarah, while we want to treat the individual and we want to help them get away from that addiction, to see the looks on the faces of moms and dads and wives and kids and brothers and sisters of the people who went through the program, that's where the real joy is. And I really appreciate what you guys are doing there. So, but that's not the only fundraiser. Now is a time where you shamelessly plug.
I will shamelessly plug our next fundraiser. So thank you for mentioning catering, because we've decided we're going to do a fundraiser. We're going to do a drive-through breakfast burrito and muffin sale. We've done a fundraiser with these breakfast burritos before, and they were very well received. So this is kind of a second try at this, except for because of COVID, we can't have people come in and sit down and eat with us. So we're doing drive-through breakfast fundraisers. It would be Saturday, March 27th, 8 to 11:30, and just pull into our parking lot and order what you want, and we'll get it for you, and you can take it home. And we hope everybody will come out and support us. And we're going to have breakfast burritos and muffins, and then we'll also have coffee and juice and stuff too, so that you can take with you. So come and see us Saturday, March 27th, 8 to 11:30 in the morning, and get one of these really good breakfast burritos. All
prepared by expert chefs in your gourmet.
That's right.
Yes. Site. And I just lost my train of thought. But what I wanted to say was, I really want to thank you, Sarah. You've got a real passion, and you can tell even in this conversation here. But just one last question. I often see and hear comments on Facebook, and it's easy for people to make comments when they really don't know, and I'll just have to say it, too lazy to get out and find what's really going on in the community. How do you rate homelessness and the ability of our community to take care of those folks, and substance abuse and the ability of our community to take care of those folks? How do you rate Owensboro with other communities?
So I think Owensboro, actually, if you come at it from a substance abuse treatment recovery services outlook, Owensboro is very treatment rich. We have almost every kind of substance abuse treatment program that exists. We have here in Owensboro. We have the traditional medical model treatment. We have intensive outpatient. We have 30-day programs. We have the long-term programs. We have faith-based programs here in Owensboro. We have the 12-step based programs like us here in Owensboro. So we have a lot of variety, and we have a lot of different options for people who need help. We also have some great homeless service providers. We work very closely. Of course, we work with men, so we work very closely with St. Benedict's Shelter. If somebody wants help at St. Benedict's, if they have a substance abuse issue and they're living there, they will help them get to a program, whether it's our program or one of the other programs. Those guys, Harry and Jeff and everybody over there at St. Benedict's, do everything they can to get their guys help that they need if the person wants it. And so I think, as far as providing services to the homeless population and to those who are dealing with addiction, Owensboro rates very high.
Well, I agree with you, Sarah, because quite often we hear stories of where other communities have given their homeless a bus ticket to Daviess County and sent them here for us to take care of. And that's probably the highest compliment. While we don't like it because we want to take care of our own population, I don't know that we've ever turned anybody away. And that was kind of my mom's philosophy. I'm the oldest of 12 kids, but if the 13th showed up at the doorstep at supper time, they ate supper. Let me again say thank you, Sarah. It's apparent your passion for the folks that you help. Your staff does a really great job. We've always gotten along well. You do not hesitate to ask and advocate, and that's what I expect out of folks who are in your position. And if the folks in this community want to help for just a little short period of time, remember, that gourmet burrito, that gourmet kitchen on March the 27th out on Beach Road. The address on Beach again?
4301 Beach Road, right next to the bypass.
4301 Beach Road, and I'm sure that they will have plenty of good food and good drink for you folks. Sarah, thanks for being with us, folks. Thank you. Hopefully, this time next week, I'll be able to proudly point that we are in the yellow and approaching green status. So everybody be safe. Remember, mask up, wash your hands, social distance, avoid big crowds, particularly people that you don't know or not in your family, and above all, taking advantage of the opportunity to get a vaccine. You're not going to be forced to, but I'll tell you that's one of those tools that we have to stay safe. So until next week, see you guys.
Thank you.
Thanks, Sarah.